study, our subject is a 45-year-old male who was recently in a motor vehicle collision. He was at a stop when he was hit from behind. Our subject experiences pain while sleeping. He's unable to work regularly at his job as an accountant. He has trouble with his ADL, and he has to wear a neck collar. The ICF is the International Classification of Functioning. We use this model when examining our subject. The main body structures involved in whiplash are the head, the neck, and the spine. As far as activities, our case study was affected in his ability to sleep due to pain, ability to lift objects, as well as his compromised activities of daily living. This affects his participation in that he was unable to go to his job as an accountant and unable to play on a soccer league as he would normally do. So here is a real-life example of how whiplash occurs. So, a couple of days ago, my vehicle was hit while I was stopped at a yield, and because of the speed of the vehicle, I didn't sustain whiplash injury. But studies have shown that regardless of vehicles, seats, and subjects, there's a basic stereotype response in rear-end motor collisions resulting in whiplash. Pathophysiology. Muscles respond to injury by contraction around the injured area. Chronic pain that accompanies cervical strain is most likely to affect the facet joints. The cervical facet joints contribute to much of the neck pain of our subject. The facet joint contains many nerve endings, which would explain the high level of pain in this area. The impact of the motor vehicle accident would have caused the neck to flex, extend, and likely rotate. This could affect the cervical structures such as the zygapophyseal joints, intervertebral discs, and the ligaments. The mechanisms of injury likely follow this sequence. At time of impact, there's a rapid acceleration, and the subject's trunk and shoulders follow, but the head doesn't follow at the same speed. When the shoulders are pushed by the forces, this inertia causes the head to move. The neck, however, takes most of the brunt of the impact.
Diagnosis. A person can be diagnosed through X-ray, MRI, which uses radio waves to create images of the organs and tissues being examined, CT, which takes X-ray images from different angles, and lastly, electromyogram, which evaluates and records electrical activity of skeletal muscle. These are all objective forms. Diagnosis can also be examined through pain scale, past medical history, physical examinations such as range of motion, pain, and function of the nerves, and these are all subjective forms. Clinical features. There are a number of symptoms that present as a result of whiplash, such as neck pain. This may indicate that damage has been due to injury of the disc. Neck pain onset presents itself between several hours to 3 days post-injury. Headaches. The structure of the neck are connected to certain types of headaches. Also, there are blurred vision, dizziness, difficulty sleeping, concentrating, and remembering. Functional status. Impairments that arise from this injury can include inability to work, inability to perform activities of daily living, compromised sleep, and compromised mobility. Participation. The participation of the patient is clearly impaired. The impairment is relieved in his inability to perform optimally at work as well as participate in soccer. While physical wellness has likely been compromised due to the whiplash, the impairment may not be completely physical because it is based on the subjective statements of the patient. It is possible the patient is unwilling to cooperate fully with recovery program. A mental block may be interfering. Medical surgical treatment. There are 3 types of treatments for whiplash. Number 1 is pain management. Rest during the injury for the first 24 hours. Then, pour cold or hot compression for 50 minutes on the neck. After, use over-the-counter pain medication such as Tylenol and Advil. as well as prescription painkillers so it can relieve the pain. Second, foam collars helps mobilize the neck. And lastly, surgery. There are five types of surgery. Discectomy. A surgeon will perform this type of surgery if the patient has herniated intervertebral disc during the accident. The surgeon will remove the disc and stabilize the spine again. Second surgery is cervical corpectomy. The surgeon removes the vertebrae to relieve pressure on the spinal cord and nerves. Third surgery is laminectomy. The surgeon removes the lamina from the spine if the lamina is pressing too much on the spinal cord. And fourth surgery is laminoplasty. The surgeon changes the shape of the lamina to make more room on the spine. And lastly, the last surgery is foraminotopy. The surgeon reduces pressure on the nerves.
Stop! Okay, start again. Video? You're recording this?
Yeah.
Okay, start again. Some brief statistics about whiplash. In Canada, nearly 200 rear-end collisions happened every day. And this is... Oh, damn it! Start again!